I think we have sadly given parents a lot of reasons to think that there's not a partnership there. Um, I think the way our healthcare system is structured, we don't communicate in the way that we should. We don't ask for permission. We don't trust our patients and their families always with transparent information. Um, and maybe it's a time limitation that we don't sit down and we don't take the time to explain all the things that we're thinking and why we're thinking them. But I don't think that we have earned the right to expect partnership and trust from our patients and their families. I'm always surprised when you walk in and you ask someone, what are your hopes and what are your worries? And it's the first time you're meeting them and they tell you all of this stuff. It's like they have just told you everything and you're on your first date with them. They don't know to trust you. They don't know what you're going to do with that information. And yet they tell you all of the things that they're hoping for and so many of the things that they're worried about. It happens so often, and yet it does feel like a surprise because that's tremendous bravery on their part to continue to trust in a system that doesn't always create an environment of safety. So I think my expectation is not that patients and families are going to trust us, to trust me, to trust our team, to trust anyone in the hospital. So when I go in with that expectation, I try to be really transparent about what we're there for, what we're there to do. And then I, as quickly as I can, stop talking and allow the space, which so often patients and families don't get, for them to talk. And oftentimes it is in their talking that they do all of the work of the consult, all of the work of telling us all of the information. They answer all the questions that we could have had without us asking the questions, because they are thinking about the same things that we might be worried about. They just haven't been given the space to say it.